When you think about community engagement, we try to encourage our students to think of it as working with the community and becoming part of their community.
You can't just go to the classroom and learn off of a PowerPoint. It's about how it is in the clinical setting and within the community.
These opportunities provide the possibility of finding out who you are in physical therapy on a whole different level.
We learn in class how to be great clinicians and how to be leaders in our field, but it is just as important to learn how to engage with the community and establish partnerships and work within the community that we're going to then work in as physical therapists.
It's really about identifying the needs and the problems that face your patients and clients within your local community, and then coming up with effective, creative, sustainable ways to meet those needs and solve those problems.
There's so many different communities in healthcare and even in athletics where communities are poorly misrepresented and they don't really have a ton of access to things like PT.
But you have to learn how to actually work with people and treat people and meet them for who they are and where they are.
Hands down, the best experience I've had at Pitt PT is the pro bono clinic.
The goal of the Birmingham Clinic is to provide medical, specialty, pharmaceutical services to anyone in our region.
People who are underinsured, uninsured, and we get to provide them physical therapy services that are making a difference in their lives.
I've gotten to know a lot of people in our community that I wouldn't have otherwise been able to meet.
And know that I'm providing a service that they wouldn't get elsewhere is just really, there aren't words to describe that.
They also have the opportunity to participate and provide educational programming at the SHRS Wellness Pavilion and the Community Engagement Center in Homewood. Those educational programs have a wellness, health promotion, and prevention focus.
Not only are they just learning all of those critical skills as an emerging physical therapist, but they're also learning how to work with patients with very challenging and complex circumstances.
I know they've certainly touched me based on some of their experiences, some of their stories, and I hope that I've had an impact on them in terms of helping them.
And when they're working with medically underserved, disadvantaged, or underrepresented clients and patients, they really start to advocate for their patients in ways that they may not be forced to do in a typical clinical setting.
Because it shows you who you are as a healthcare provider and as a physical therapist.
So they're working with faculty who are really committed to working in the community and helping people who really may struggle to access the mainstream healthcare system. And so those faculty are really modeling what are best practices for our providers. And it's really a privilege to foster these collaborations with Pitt and with programs like the DPT program, because it works both ways. It's so impactful for the patients, but it's so impactful for the students, and we're really lucky for that.
Our students also here in Pittsburgh have actually established a student-led organization called the Pitt DPT Student Service Board.
And the Student Service Board's main goal is to preserve the integrity of every opportunity we have, but advance it so that all Pitt students are able to help out, able to participate, and just explore what it really means to be a better PT in these kind of settings.
They provide community engaged activities, programs, and these are all student-led, and they are truly meeting the needs of the individuals in our community.
I have been able to be a volunteer with the local sled hockey team, so it's an adaptive ice hockey team.
Many of our community engagement opportunities are interprofessional, and that's a really wonderful thing, because we know that when many healthcare professionals from different backgrounds and different disciplines come together with collaborative and team-based care, it improves quality of care and it also improves access to care. But we also have, with the hybrid DPT option, opportunities for our students to participate in community-engaged activities across the country. So we are teaching those students to get to know their communities, interact and make these connections with community members in their local areas, and to identify needs and come up with creative, sustainable ways to meet those needs within their local areas that they may someday work and live in.
And I think it's honestly our responsibility as a profession to be able and to do things like this, to expand our own breadth of knowledge, not only about PT, but about the communities that we serve.
Without having this experience, I truly would be a different physical therapist.
And for me, these experiences are just rounding out the education on a complete level, where you should feel confident coming out of a program like Pitt PT, knowing that you can handle whatever comes through that door.